This is going to be a non-technical layman's version of really genetic and genomic testing, what's happening in the marketplace today, what we need to think about as plan sponsors. So when we go through this slide deck, this could be super complicated material. I'm just doing a very high level overview today, just to kind of help everybody be aware of what's going on in the marketplace. Again, really what's coming, what we need to think about, pros and the cons of things, and really looking at this particular topic from a plan sponsor point of view or a payer point of view. It's interesting because I look at everything from an insurance perspective. I was out visiting a client last week, and I was in a hotel with low railings, and it was all open and it was really high. And I was just thinking, this is an insurance nightmare. And my client was like, but it's so pretty. It is pretty. But so I always think of things like, when you think about genomic testing and the pros and the cons, I really look at this as how to protect our plan sponsors and protect our plan participants, and really think about the outcomes, what it could mean for people. So given that, I kind of just wanted to do a quick overview of genetic and genomic testing, just to kind of set the stage for what we're going to be talking about today. So in 2003, interestingly, it was a female researcher trying to figure out how to make yogurt not sour, and really diving into the microbiology of the bacteria and the living organisms within the yogurt, trying to figure out what created the tart flavor. That research and the things that they found in that research really were shared with other researchers in the U.S. that in 2003 made a huge leap in understanding the human genome. So we actually were able to map out the actual human DNA, which allows researchers, obviously, to begin to understand the blueprint of building a person. And really looking at mutations within those genetic letters to figure out if you have a disease or a predisposition for a disease, those letters might be off a little bit and they might not be perfect. So that really helped them understand the human genome. And since then, we've had an explosion with people trying to understand and use genetic testing and genomic testing to really guide treatment plans. And so what we're going to talk about today is that discovery, or that uncovering of the human genome, really how we can use that to identify gene mutations, which would lead to certain diseases or illnesses, how the understanding of the human genome is helping us with prescription drug results. So I'm going to give a couple of examples of how they're using genetic testing to predetermine what drugs, how much of the drug, the amounts, and the efficacy or the effectiveness of the drug based on that person's genetic has really come full circle for us. It also, genetic testing has helped us uncover inherent diseases, so what you're predisposed for. Predisposition for something doesn't mean it's a diagnosis. It really would just help the member understand what potentially they were predetermined as a risk category. And then, of course, providing more insight on how to tackle these diseases. So, Kelly, I have a video. And again, Kelly had said at the beginning, if you can turn the volume up on your computer, I'd really like to play a quick video talking about how they're editing human genome to solve diseases and solve problems. So Kelly, if you can share that video, that would be great. Oh, we're already, yeah, thanks. Perfect.
To understand CRISPR gene editing, let's start with what is DNA? Handed down from generation to generation, every cell in your body carries a copy of your genetic code called your genome. It's made up of DNA. It's like a book that describes you, a book made up of 3 billion letters arranged in different sequences that make up DNA words. These words can influence the traits that you take on: athletic, intelligent, gifted. Recently, computers have deciphered the entire human genome and have identified genetic mutations behind diseases that currently have no cure. With CRISPR, we can edit DNA. CRISPR is a man-made molecule that can be programmed to find mutated or diseased DNA. It's also equipped with a pair of molecular scissors. So once CRISPR finds its target DNA, it can snip that section from the genome. Sometimes the body can repair itself. Other times, scientists can patch it with corrected letters. If this happens in egg, sperm, or embryonic cells, the changes will be permanent and passed on to future generations. CRISPR is already showing promise. It's being used to cut out the HIV virus, eliminate Huntington's disease from the brain, and even alter a mosquito's genome so it's less likely to spread malaria and Zika. CRISPR could lead to a new world of treatments, curing diseases and even eliminating them, so future generations won't ever have to suffer from them again.
All right, we're going to switch back over to the PowerPoint, but just a few comments on that. So that is actually where they've not only understood and decoded the human genome, but they have a way to go in and edit or change the genome, which is crazy exciting, because they're going to be able to cure diseases that we've never been able to cure before. It's definitely given us a path to understanding cancer cells better than ever before, and there are a lot of new treatments coming out for a lot of the diseases. Some of the things, again, back to putting my insurance consultant hat on, there are things that are solving and curing diseases, which is incredibly promising for all of us. But the cost associated with some of these treatments is astronomical. So some of these treatments are in the form of pharmacogenomics, which are specialty drugs that are targeted genetically. So they're modified to basically target a certain problem or illness, and potentially, there's one clinical trial that's taking place in Philadelphia that requires a 20 to 25 day hospital stay with the actual medication. So we'll watch that. The cost of that particular trial is somewhere between $500,000 and $700,000. So we're hopeful that it treats something and cures it. But we, as the payers, the employer sponsors, have to figure out and really kind of understand, specifically how we're going to afford that, what the plan will pay for, obviously under the medical plans, and what are the clinical edits or pre-approval process or pre-certification authorizations that we need to put in place surrounding some of these high-tech treatment plans. Interestingly, this was in the news, the slide that I have up, GlaxoSmithKline, which is actually one of my clients, I've been working with them for almost 30 years now as a medical and pharmaceutical consultant. They just announced that they were going to partner with 23andMe, which is one of the labs or the services where you can do some genetic testing. They just signed a deal for $300 million to share in some of the genetic information that they have. So 23andMe, you can go out to their website. They send you a kit. You put saliva into a tube. You mail it back, and they test your genetic DNA for precursors. And I think there's 2 or 3 levels. One is, just an ancestry level. And the next one is health information as well, where they're testing for some basic things. So we're going to get into that in a minute. But right now, they're going to have access, GSK has access to about 4 million people's genetic information. And I am one of those 4 million. So hopefully they can devise and really do a lot of research on genetic makeup and come up with some cures for things for sure. So right now, personal medicine or genetic testing can really test for approximately, 2,000 conditions. One of the things that, we talk about a lot in benefits is trying to get out in front of things early, trying to understand the large claimants. I think one of the things that we've seen a lot in the last year, I would say, is, when we do the consulting for clients, one of the first things we do at the beginning of the year is the end of the first quarter, right after renewal. Of course, you look at your utilization data from calendar year prior. And one of the things that we're noticing now and kind of wrapping up those strategy meetings is that the high claimants or the high cost activity is really driving our trend. So things that we've done in the past, like the wellness initiatives that we've undertaken, the high deductible health plans that have been kind of the wave of the future for the last, 5 to 6 years, trying to make people better consumers by adding those high deductibles and having an HSA in place where we can encourage people to participate in healthy behaviors or modify behavior and give them dollars or value-based plan design incentives into the HSA for achieving certain goals. Like if you get your blood pressure checked or, you have a primary care physical exam, you might get credit in your HSA for that. So those initiatives have really kind of done what they can in really controlling cost and controlling, trend on our medical plans. And what we're seeing really in the last year is that, you can have a $5 million spend and one person spending $1 million out of the 5. So those are the types of things that are our new challenge. The high claimants for sure. But these categories of diseases where there's specialty drugs that are $1 million a year are certainly driving our thoughts and our strategies moving forward. And one of the things that we need to focus on is how to get out in front of some of those really high cost, high tech opportunities, I will call them, because they are opportunities as they're hopefully curing things, but at an enormous price to the plan. So when you look at personalized medicine, we actually can start to think of strategies where we might be able to deploy some of this new technology to actually curb cost. So if you kind of look down the list of the genetic testing available today in the marketplace, obviously, prenatal testing is important for people maybe that have a predisposition or a problematic pregnancy. Diagnostic testing. So when you go to 23andMe or you do some preventive genetic testing, they can actually tell you whether you have the precursor or the genetic predisposition for breast cancer, maybe some types of cancer treatments or cancer diseases, Hodgkin's lymphoma. There's a bunch of things that you can test genetically for a predisposition. And again, a predisposition doesn't necessarily mean a diagnosis. It's really just something to tell the person, this is something that you should watch out for. And there's hereditary concerns that you can use genetic testing for. So in my particular family, my mom has an illness that is definitely hereditary. And so getting the genetic testing and doing some pre-planning isn't such a bad thing for me as a person, because then you can get out in front of the illness and maybe have specific medications that might help you curb the occurrence of it. So the pharmacogenomics testing is really how to use the medicines and how the medicines are processed by each person's body. And I'll give you 2 examples of the interesting, advancements that we've made in using genetic testing in pharmacy. So and again, pharmacogenetics is really just using to use the medication to guide improved decisions on treating patients is really a good definition of that. I'll give you two examples. There's a breast cancer specialty drug called tamoxifen. It's very expensive. It's probably, in most cases, $1,000 a month for the treatment. And tamoxifen can only be effective if you have a certain type of enzyme in your body. So there are arguably, statistics vary, but it's been said that 2 out of 5 women that go on tamoxifen don't have the proper enzyme to break down that drug and use it effectively. So, of course, if you're doing the genetic testing or the enzyme test in advance to putting somebody on tamoxifen, you'd be able to tell whether that particular drug would be enabled to be effective for that person to prevent the recurrence of breast cancer. So it's very important, some of the breakthroughs that are being made be used effectively. And we're going to get into some of the pros and the cons a little bit later in the slides. But certainly the first thing that comes to mind is privacy and some of the other elements that have to go into thinking through using some of these technologies and new breakthroughs in a way that will help the members and protect them. Coumadin is another drug that is a really good example of how this breakthrough has helped deploy that medication. So Coumadin is an anticoagulant. It's used for people with blood clots, where they have to take this medicine to make sure that their blood maintains a thin consistency so that they don't have clots that are, could be fatal. But on the flip side of that, you don't want to have too much of the drug in your system because you could bleed to death. So it is a situation where that particular illness is one of the leading causes of death in the beginning stages of treatment. So one of the things that's been a huge breakthrough in the last couple of years is a test that is a mouth swab where they can actually test your metabolism to see how that drug is metabolized in each individual person, so that right out of the gate when they're prescribing Coumadin, it can be much more targeted approach rather than a 5 or 6 day hospital stay as it was a decade ago, where they were trying to get the balance right and the blood consistency correct. So things like that is really what we're talking about in kind of the breakthrough and using some of this genetic testing to kind of, obviously better use medicine and more effectively use medicine. And certainly some of these expensive pharmaceuticals, if they're not deemed appropriate or being able to be effective by an individual, using a different course of treatment for them instead of putting them on a drug that may not actually result in protecting them. So we've seen a huge rapid growth in genetic testing for sure. As it's become more popular, once these various companies that sell these genetic tests to the public were able to go to market, there's been a huge push in the media. Certainly, we've all been sitting around in our family rooms watching some of the ancestry advertisements, as well as some of the genetic testing opportunities that are available for all of us out in the marketplace. And the test costs have come down a lot. So definitely something that people are looking into individually. So really, how does genetic testing differ from genomic testing? So genetic testing, the simplest way to think about genetic testing is genetics are genetics. So you were born with your genetics, you were born with your DNA, and it's who you are as a person. So your genetics and your DNA develop into things like the color of your eyes, the color of your skin, the type of hair you have, your talent, maybe if you're able to play the violin. So your DNA and your genetics and how bright you are in school, all of those things are kind of yours at birth, and each person is different and each person is an individual. The genomic testing is a little bit different because the genomic testing is testing your genes in your DNA as you develop as a human being through the path of your life. So really some of the exposures that you've had and how those exposures or aging actually affects your genes and your DNA. So, people who sunbathe damage their genes and their DNA from overexposure to UV light. So that would be a genomic test that would see how your genes are reacting to the impact of, just kind of life and alterations as you go through life. So hopefully that makes sense. It's a little bit complicated, and I've really taken a stab at kind of giving you a layman's overview of the two. So genomic testing really needs to be done over a longer period of time. So if you do genomic testing when you're 20, you might want to do more genomic testing at 40 if you have a predisposition for a certain disease, because certainly as you age, that would change. So now we're going to get into should employers offer genetic testing? There are a lot of conversations going around in the boardrooms right now because, some of the pros, and I'll give you, the top pros are certainly making medications more effective. The specialty drugs are definitely driving our costs. So we want to make sure that people that have the best opportunity to metabolize those particular expensive drugs are the ones that are clinically appropriate for those drugs. Information out to the membership. We went through all of those wellness programs and trying to get people to live healthy lifestyles and really paying attention to the number of steps you take with your Fitbit, competitions on getting up and moving from your desk. So we've really taken a lot of initiatives on the wellness side, and some companies are actually looking at offering genetic testing as an opportunity within the wellness category, keeping people aware of their genetics, what their predisposition is for certain things. It's interesting because I did the 23andMe as a Christmas gift to my kids and myself, and it is interesting what comes back. It not only gives you your ancestry and what part of the world your family's from, but it actually gives you, 5 or 6, the basic one that's $99 or something like that, gives you the basic precursors for like BRCA, for breast cancer, and just kind of does a little dabbling in the genetic predisposition category. The cons, there's a lot of them. And I think that's why most employers have really taken a step back and taken a wait and see kind of approach to see what happens. Because, obviously the number one concern in the cons category would be privacy. People are very concerned about other people having their genetic code and their DNA makeup. Some people may be very concerned about their employers having access to that information. Certainly, if you do offer genetic testing and you do get reports back, they should be aggregated to kind of just let the people that participated what their primary concerns or driving predispositions are. I haven't had any of my clients offer free genetic testing to their employees, but it's something that people are thinking about doing. And then, of course, you have to be careful about the vendor that you choose, making sure that the vendor has the appropriate PHI and how they're storing the information, how they're gathering the information, who they're sharing the information with. Do you have the right for privacy? So like with 23andMe, when you send in your sample, you can check off a box that says you want confidentiality and privacy, or you can leave it open so that, researchers like GSK would have access to your genetic DNA results. So there's a lot of things to think about. I think most employers see the opportunity with genetic testing, but they also see a strong case for, just being careful on the liability side for sure. So the conditions that you can test kind of a predisposition for, and I put it at the top in the header, I want to make sure predisposition does not mean a diagnosis. So it just means that you have a predisposition genetically for developing that particular illness, but there are some for cancer, melanoma. There's a large amount of continual breakthroughs in kind of what they're able to look at as a predisposition for. The BRCA gene is something that the Affordable Care Act or healthcare reform says that you have to cover for free in your medical plans. So I think the insurance companies just can't keep up with all of the new breakthroughs in the genetic testing. But it's important for employers to understand the screenings and the follow-up process and how those can be used effectively, and kind of thinking out a thoughtful future plan for some of this testing. So how does it work? An individual typically in the test kits that are out in the marketplace today, and even if you offer it free as an employer to your employees, they would have to complete a saliva test. So they give you a little tube and you put saliva into the tube, you cap it, you put the barcode on that you register for online. Then the genetic testing takes, I think I got mine back in 6 weeks. And then they send you a report. You can have the report sent just to the individual. You can have the report sent to the doctor. Certainly there are genetic tests going on in the doctor's office where the doctor is ordering a test to see, in the case of Coumadin or tamoxifen or some of the drugs that they are trying to prescribe in order to tell how much of the drug to prescribe or whether the drug would be effective or not. Those are tests that are being done right in the doctor's office. But these are the tests that you can do kind of, through the mail, so to speak, or sign up for online. And then the early identification results come back, and I have to say, mine was very interesting. It said, exactly where my family history from an ancestry perspective was, and some of it was surprising. I couldn't do a commercial because it wasn't that surprising, but how people think they're Scottish and they turn out to be Polish. So nothing that surprising. But they did go through, certain illnesses, Alzheimer's and certain categories of illness that I either present as a precursor or predisposition for or not. So it was very interesting. And again, some of the test companies have counselors available for you to ask questions, and kind of if something did come back and say you did have a precursor for a certain type of illness or category of illnesses, they do have counselors on staff that can actually walk you through it, things to think about, things to ask your physician. Would it be smart to have, further tests done, things like that. So each company kind of offers a different suite of services. And then, of course, the percentage of, this is always a surprising slide for some people, that, 75% of cancer patients are on a drug that's either ineffective or maybe not the most effective drug that they can be on. MS is one that has had a lot of breakthroughs in the last, year that significantly improve the chances if genetic testing is done. There's a new migraine medication. It's a specialty drug that was launched a couple of months ago that is at a price tag of $7,000 a month for people with recurring migraines. So there's a lot of people on a lot of medication it's either not effective or it's not the most effective, and could be helped by some of the inroads being made in the pharmacogenomic or genetic testing for pharmacy. And again, when building our plans, so I always go back to how does this affect us as employers and people trying to maintain affordability within our healthcare plans. Those are things that we need to think about. Are we spending our dollars wisely? And could we improve the outcomes and improve the expenditures if we use some of these new technologies? And then if you do use some of those technologies, what's the best way to do it? So already under the PBM, so for those of you that are self-funded and you have a carrier and you have a PBM or a pharmacy benefit manager managing your pharmacy, a lot of those pharmaceutical management companies have already deployed clinical programs using some of these technologies for certain types of drug categories to make sure that tamoxifen is prescribed and that test is completed prior to writing the prescription for tamoxifen to test whether the person contains that enzyme and can break down that drug and make it effective. Or if they don't, what's the second course of treatment? So some of those are already clinical edits within your programs, but definitely something during the strategy sessions that you should be talking to your carriers about, really understanding the breakthroughs and how you can better use them based on your current utilization. Employers' interest and employee interest is very high. So we've, like I said, we watch the commercials. We watch, everybody's interested to see where their family tree is originally from, hundreds of years ago, their genetic makeup. I can tell you when you get really, really busy, you do worry sometimes, am I losing my mind or did I just not remember hearing that from that person? So testing for memory loss and Alzheimer's and things like that might be, just something out of idle curiosity versus, your family has a history of cancer and you want to find out whether you have that predisposition or a precursor for that. So if you do, maybe you get mammographies more often or earlier than most people would, typically without that precursor. And really, are the insurance companies covering genetic testing? I don't think they can keep up. So these things are happening so quickly and so fast in the world of research, and certainly specialty drugs and what's coming out on the market, what the FDA is allowing as the clinical trials with new medications. There's a host of new treatments for some types of illnesses, including some cancers, where they're genetically modifying viruses, and they're using the viruses to fight the cancer cells, where the cancer cells are being attacked by the virus. So I think the childhood leukemia at Children's Hospital in Philadelphia, there was a clinical trial using measles, the measles virus, where they altered the measles virus and they used it almost as a battleship against the actual cancer cells. And they've had some really favorable outcomes and results, more favorable, quicker results than some of the past treatments of chemotherapy and radiation. So some of this genetic testing is really coming fast and furious. And I'm not sure that some of our carriers can kind of keep up with what's out in the marketplace. Are we going to cover it? And as self-insured employers, again, we would want to make sure that you're covering the things that make sense and maybe not covering the things that wouldn't yield a better outcome for the patient or a better cost outcome for the employer or the payer. And I'm sure the insurance companies are doing the same thing. They're looking at each of these clinical trials, looking at the pros and the cons of things. Certainly, if it's a cure for something, it's probably going to be covered once it gets through testing. And if it's a better treatment plan with less side effects, that is something that, is the painstakingly process of going through what can we afford, what should we cover, and really kind of thoughtfully making these plan design changes as you go forward. This is anecdotal, but I thought it was really interesting, so I put it in here. Geisinger Healthcare System is a system in central Pennsylvania, right very close to my alma mater of Penn State University, which is the geographical center of Pennsylvania. Just a little FYI of non-essential information. But Geisinger's in the center of Pennsylvania, and they're actually using genetic testing in a proactive, preventive manner. So there was an article in Modern Healthcare on kind of the pilot program that they're using, kind of trying to see if they can get in front of some catastrophic diseases with patients and trying to get people that do have a precursor or predisposition for a certain illness to make sure they're getting wellness and preventive checks so that they can catch it really early and get out in front of the disease. So that's interesting. We're going to be watching that. They have a very large footprint, and it's going to be very interesting how they use that information going forward to help members either avoid or cure diseases in the very early stages. So I had mentioned before, there's a lot of vendors in this space that are out in the public. So not only do the physicians treating your members have access to genetic testing, but the public does as well. So Color, WGA, 23andMe are some of the most popular ones. I kind of gave you a chart you can read later on, how you use both of those, all three of those, the venue and some of the pros and the cons of, kind of just how those vendors work and how they share the information and whether it's private or not. We covered some of this, the risk associated with the genetic testing. Definitely the sensitivity and the privacy concerns, I think, are probably the biggest concern that people have. I have a funny picture in here of my son. I think it's next. Yeah, so that's my son, Lewis. He's a freshman at the United States Naval Academy. And I do remember when I asked him to spit in the tube and give me some of his saliva so we can do some genetic testing, he was like, "Mom, they can clone me now." And I assured him that nobody would want two of him. Teasing, I think I would like two of him. But anyway, so privacy concerns, some people, don't want their employers to know. Some people don't want the insurance companies to know, what their genetic predisposition for certain diseases are. Employers obviously want to make sure that you have secured system and protocols in place for whatever genetic testing company that you partner with. Maintain privacy and confidentiality of the person's information, as it's absolutely HIPAA related. And really, just aggressively and proactively watch how the information is being used, what kind of data sets are coming back, because each company does a different set of genetic testing, testing for different genomes and different disease categories. So obviously, if you're going to do it, you want to make sure that if you are going to do it, the employee participates in that process electively, and you're testing for the widest and the most genetic deficiencies as possible. So you can kind of run over, the gamut of illnesses that you want to kind of try to get out in front of and maybe preventable. So legislative issues, Gina's laws definitely comes into play when you're looking at offering this to your employees as an employer. You can't, there's a lot of things that you can't do when you're doing the genetic testing, right? You can't adjust premiums or contribution based on genetic information. You can't use genetic information for underwriting purposes. Neither can your insurance company. You can't require anybody to undergo genetic testing, but you can make it voluntary. You can pay for it. You can, kind of offer the test outside of, your open enrollment period and just make it purely voluntary as a wellness campaign. Again, I don't have any clients doing that today, but I think as we move into a time where there are some significant benefits to really having people understand how their genetic makeup really affects their life and their predisposition for illnesses, especially chronic illnesses like diabetes and things like that, with a genomic testing and trying to figure out, where your body is as it stands today and what diseases that you might be close to having so that you can intervene maybe even with lifestyle changes to curb that momentum. So the legal issues are definitely front and center. Employers are thinking about these things. They're thinking about how they're deploying these new breakthroughs in technology and really, trying to come up with the correct balance. And it's the correct balance in everything we do, right? So when you offer benefits, you're trying to attract and retain your good employees and talents. And I think one of the things that we've seen in kind of evaluating how you roll out your plans, what you cover, what you don't cover, is you want to try to do it for the good of the masses. And you want to try to do it so that we can help our employees and their families stay healthy. They come to work and they're productive and they're not worried about, spouses or dependents at home with illnesses, trying to get them to the right place the first time for care. All of the things that we think about in a strategy, I think this needs to be added to the list of topics to discuss in your strategy meeting, and really how to develop a robust plan to make sure that you can, attract and retain good talent. I will also say, just anecdotally, one of the other things that I've seen a significant change in this year versus in past years in those strategy meetings with my clients is the pendulum has swung a little bit back the other way. So for years, we were trying to figure out how to make employees more accountable, rolling out high deductible plans with HSAs, trying to get our employees to do the right thing through value-based plan design initiatives where, you might say to your diabetics, if you're adherent with your medicine and you get your diabetic retinal eye exam done and podiatric care done on a regular basis, you can earn money into your HSA for the high deductible plan. And now we've really seen the pendulum swing back the other way with the low unemployment numbers of under 4%, and trying to, employers are trying to face the difficult task of getting talent in the door, right? Keeping your good talent from competitors and retaining and attracting employees. So a lot of employers this year are changing the conversation and saying, what can I add to my suite of benefits? What voluntary benefits are popular? What should we be looking at over the summer to roll out during open enrollment this year? So it's a bigger conversation, and it is definitely a switch and a change in the conversation. And I think making this genetic testing available to people on a voluntary basis and paying for it, kind of in the vein of being preventive, is definitely one of the things that's on the table this year in the topics of conversation. So that really wraps it up for me. Kelly, I know I tried to save a little bit of time for questions. I'm not sure if we have any. I'll do my best to answer your questions. Of course, I'm not a pharmacist and I'm not a physician. I'm not clinical. So I will do my best to answer your questions if anybody wants to post any questions. Kelly, I think we have a Q&A at the bottom of the screen where they can type in their questions and only you and I can see them.
Yes, that's right. We did have one question come in, and I'm not sure at which point it came in, but any data on the percentage of, quote, false positives?
Oh, that's a good question. I don't know the answer to that, but we will definitely, that's a great question. I will find out. I am not sure. I know that when you, just from personal experience, certainly at the doctor's office, I would think the number would be low of false positives. But, they give you very specific instructions on handling. So when you get, like, I got my kit in the mail, they tell you to go and register the barcode on your kit online with your name, your address, and your information so that they know what kit went to what person. Then that barcode has a sticker in the kit that you put on the sample to make sure that you're getting your genetic test back. As far as false positives with those, public companies, I don't know, but I will endeavor to find out because that's a really good question. And Kelly,
there's a good one.
Okay, go ahead. I was going to say, you can also, if one occurs to you later, email me and I'll be happy to respond.
So another one that just came in, any advice on evaluating the various testing companies?
There is a slide in here that gives you promising things to think about. And certainly we have a detailed spreadsheet of what we use with our clients. I will have to go back and see if I can make that a public document. It typically is not a public document, but for our clients, we do go through kind of a pros and the cons of each carrier or vendor. It wouldn't be anything unlike an RFP process for anything else, though. I think there's probably, 15 to 25 really good questions that you would want to ask each and every one of the vendors. Performance guarantees on turnaround time would be certainly something that I would put in there if you were negotiating as an employer. Confidentiality, you would have to vet through that. What type of aggregated reports you were getting back. But there is a spreadsheet. I'll see if I'm able to share that with the public. But I would say it's just an RFP process, just like any other evaluation you were undertaking, with key critical things that you would want to check the box on.
Okay, wonderful. Thank you, Marybeth. And thank you all for joining us today. You can join us in Las Vegas, hear lots more from Marybeth and some of the other benefits experts we are bringing together September 30th to October 3rd. It's going to be a great conference. You can register at our website, ucs-edu.net. And if you use today's registration code for Marybeth, it's YTRI for Trion, YTRI. You'll get an additional $200 off of your registration fee. So you'll be saving a total of about $400 off the registration fee with that registration code, compliments of Trion and Marybeth. Any last comments or thoughts, Marybeth?
No, I don't think so. I'm very excited to see everybody in Vegas. It's always fun, and those conferences are very educational. So we hope to see you there. And Kelly and myself will be presenting another power lunch, probably a back to the 25-minute power lunch here coming up in September. So visit the University Conference Service webpage for more information on that. And certainly my webpage, mbgrayhealthcare.com, you can find upcoming events and register for the next power lunch there as well.
And we're thinking Wednesday, September 5th?
Yes.
Okay, perfect. All right, well, thank you again, Marybeth. Excellent webinar. I think you presented a lot of fantastic information. Thank you all for joining us. I hope everybody has a great